Hello, this is Dr. David Greene, CEO of the Arizona Pain Network. The topic today is what you need to know about joint arthritis. Arthritis is the number one leading cause of disability in America. With over 50 million Americans being affected, it refers to inflammation of one or more of your joints, with the main symptoms being pain and stiffness. And typically it gets worse with age. There are two main types of arthritis. One is osteoarthritis and the second is rheumatoid arthritis. Osteoarthritis refers to the wear and tear, DJD, which is degenerative joint disease, where cartilage tends to break down. Rheumatoid arthritis is actually an autoimmune disease where the body targets the lining of the joints. It doesn't target the cartilage, that's sort of an after effect. Other less common types are psoriatic arthritis, lupus, and then crystalline arthritis, which is usually from gout. So when you start talking about osteoarthritis, it's actually a ratio problem. You still make cartilage like you used to throughout life for the most part, but you're actually losing it faster. So it becomes a ratio problem between making it the same and then losing it more. Rheumatoid arthritis is a condition that is not hereditary. Women are affected more common than men. And the autoimmune part is that your body actually makes antibodies against your own tissue, and that is against the synovial lining of your joints. Risk factors for arthritis include family history, increasing age. Females are more common than males when it comes to rheumatoid arthritis, but it's actually the opposite for gout, the crystalline type of arthritis. Post-traumatic, if you have a knee injury or shoulder injury from a sports or a car accident, the chances of having arthritis as a result of that down the road are higher. And then obesity, it just goes to reason that if you have more weight going across certain joints, weight-bearing joints, then the chances of arthritis increase. The symptoms of arthritis are going to vary between individuals, but usually it's pain and stiffness, swelling from time to time, and then decreased range of motion. There are quite a few treatment options for arthritis outside of joint replacement. The first is activity avoidance. If it hurts, either don't do it or cut back on how often you do it. If you're an avid runner, for instance, and it starts to painful more and more, then switch over, cross-train, do some swimming, do some cycling. If you play golf 5-6 days a week, cut it back to 3 or 4 days a week if it's very painful afterwards. Medications may include over-the-counter, oral or topical medications, or prescription medications, which could be oral or topical as well. Short-term opiates can be beneficial, long-term is a bad idea. Bracing, such as you see here with an offloader brace, can help take pressure off the arthritic side of the knee and put it to the more normal side. A cane can be very helpful for unloading arthritic joints. Physical therapy and chiropractic treatment can be exceptionally helpful with pain relief. And then acupuncture and TENS units are great as well. When you look at interventional treatments for arthritis, the gold standard is steroid injections. These have been around for decades. They work extremely well, usually 75-80% good to excellent results for weeks to months, and they can be repeated every few months. It used to be thought that steroid injections actually did damage to cartilage, but now we know that there's not enough evidence to actually support that. Hyaluronic acid is viscosupplementation, and that is things like Synvisc and Hyalgan, which have been FDA approved for knee injections and other joints, and they have about a 65% good to excellent outcome at 6 to 12 months. Prolotherapy is fairly common, and then regenerative medicine treatments such as PRP therapy, which is platelet-rich plasma therapy, and stem cell injections. These are becoming more and more popular because they actually have the potential to repair and regenerate damage from arthritis, as opposed to simply being a steroid injection type of Band-Aid. Okay, radiofrequency ablation I put on here because for the back, if a facet injection or one of the medial branch block injections works well for facet joint arthritis, and then it wears off, then a radiofrequency ablation procedure is really cutting edge. It can give 12 to 24 months of consistent pain relief. So the outcomes with the non-operative arthritis treatments, vast majority of the time, patients are able to avoid or delay the need for surgery. Joint replacements are not meant to last forever. 10 to 20 years, so let's say you're 55 and you get a joint replacement, you may need a revision by the time you're 70, 75. And the revisions really never have as good outcomes as the initial procedure. Success rates with the steroid or HA or regenerative medicine injections have been shown to be over 75 to 80%. Topical creams, there was a huge study done last year of about 4,000 patients for prescription creams, and this was shown to be 83% effective for all types of pain conditions such as arthritis. Thankfully, arthritis is not a deadly disease. It never killed anybody, so it's all quality of life conditions that we're talking about here. The top pain management clinics in Arizona are Arizona Pain Specialists. They have valley-wide locations that accept over 50 insurances and offer comprehensive pain treatments such as everything we just discussed. All the docs are board certified. The number to call for treatment is 602-507-6550 and visit us online at ArizonaPainNetwork.com. I'm Dr. David Greene with the network. Your pain stops here.